This is chapter 33, which is an odd combination. I guess it just kind of threw some things, the last of them together, the antivirals, antimalarials, and anthelmintics. Okay, we're going to start with antivirals. This chapter covers the non-HIV antivirals, because the next chapter that we're going to cover, well, 2 chapters from now, chapter 35 goes into specific HIV, or human immune deficiency virus drugs. Okay, so viruses are difficult to kill. They have to live within, live inside a living host, and they reproduce within there. They use the DNA and RNA of the host to duplicate themselves. They must have a host to be able to live. So I thought that was a good picture, just reminding you of how viruses work. Most common viral infections in human beings are influenza, herpes virus, and viral hepatitis. The common influenzas that we see are A and B. Herpes viruses, there's this herpes simplex 1 and 2. We used to call them the cold sore being 1 and genital being 2, but we've discovered now that either can be on different parts of the body, but one is a type 1 and one is a herpes simplex type 2. Varicella zoster, which is the chickenpox and the shingles. Epstein-Barr, which is what causes mononucleosis, and cytomegalovirus, or CMV, which mostly we hear about those being so dangerous in pregnant women because of fetal deformities problems. And in hepatitis B and C, they are now coming up with treatments for hepatitis C. Vaccines, there are many vaccines for preventing viral infections, providing immunity for smallpox, chickenpox, mumps, rabies, and influenza, which is in chapter 36, but we are not going to go into the vaccines. We will skip over that chapter. You will get some vaccines, I guess, in your other med-surg classes, of quite a bit of it in pediatrics, and then it's supposed to be covered pretty well in community. So antivirals for non-HIV drugs, they're to prevent or delay the spread of viral infections. So preventive is the vaccines, delaying the spread within itself for its reproduction. We can't kill the virus, but we can do things to keep it from duplicating itself and then dying out. The topical antivirals, penciclovir, trifluridine are the ones I've seen the most to treat the herpes simplex viruses. There's another class, the neuraminidase inhibitors decrease the release of the viruses, so it decreases the spread. Zanamivir and oseltamivir, if you notice a VIR in many antiviral medications, you will see the VIR within them. Remember VIR for viral, so for antiviral, to help you recognize some of these. Gamma globulin, immune globulin, or IgG, is a bunch of antibodies that are given to the blood to give you a passive immunity to viruses. That's one of those things you might be seeing when you are working and they have a exposure protocol. If you've had a needle stick, they will often give you an IgG to try to boost your body while they're doing testing for if you've contracted a virus, like the HIV or hepatitis from a patient. The purines, they interfere with the steps of the DNA synthesis so that it cannot duplicate itself. Many of these drugs are acyclovir, riboflavin, famciclovir, gammacyclovir, valcyclovir. As again, you see the VIR name. Acyclovir and valcyclovir or Valtrex are used quite often on herpes simplex 2. It can be 1 or 2, like an ointment for the lip, and the herpes simplex 2 a lot of times is given in oral form. Also given for herpes zoster, which is shingles, and treating cytomegalovirus. RSV is respiratory syncytial virus that can make children very, very, very sick. Young children, they often will get it when they first start entering daycares, and they give them an aerosol treatment with ribavirin if they have isolated that infection. So on these purines, we're going to go into a little acyclovir because it is fairly common. It is in table 33.1. It's for herpes zoster, which is shingles, and herpes simplex virus 1, which is like the cold sores. It's a pregnancy category B. It is given orally for herpes zoster and herpes simplex. The varicella zoster immune globulin is immunization for prevention of the varicella or chickenpox. That they also list the RSV that I mentioned and the valcyclovir on the chart. Valcyclovir is given orally. It can be given for an acute outbreak or prophylaxisly to prevent outbreaks. Sometimes you give it once a day for a while. For somebody who's already had it been treated, you will do the 3-day different regimens for depending on what you need to treat, and all of it is a category B. And it's widely spread through the body. The end of table 33.1 goes over some of these. Chart 33.1 talks about acyclovir a little more in depth. I have never given it IV. I have given it PO, but I see it comes in both routes. Contraindications: hypersensitivity, of course, severe renal or hepatic disease. So when nursing action is going to be checking those labs. If you look in your nursing process on page 453, where it has nursing interventions, you see the squiggly lightning thing next to certain things. I would certainly remember those because those are keys of very important things for the nurse to know. Looking at the renal function, of course, you're looking at urinary output, BUN, and creatinine. They can be blood dyscrasia, so you're looking at their CBC, their platelet count. Platelets low would be a thrombocytopenia. Leukopenia would be a white blood count that's very low, below a 4. A low hemoglobin and hematocrit, you should know your baselines for your hemoglobin and hematocrit, depending on male or female hemoglobin. Lowest should be 12 female, 14 male, and your hematocrit should be 3 times your hemoglobin. Just telling you those are some things you should put in your mind to keep for the rest of your nursing career. Monitor your blood pressure because they can have orthostatic hypotension, which is a positional. When they come up, their blood pressure drops and they get dizzy. You see on the teaching, adequate fluids, encouraging fluids. Never give the medication IV rapidly. It's never in a push. It's in a slow, gradual drip. Some of the side effects: the GI symptoms of nausea, anorexia, vomiting, diarrhea. They can also have some neurological changes with a headache, tremors, agitation. They can have skin response with a rash, pruritus, which is itching. Phlebitis at the site, which is an inflammation of the vein. Again, because it can be corrosive, you should be giving it very slowly. If it has neurological effects, obviously, we mentioned with the headaches and agitation, you're looking for neurological changes such as neuropathy, seizures. Definitely watching the kidney function for nephrotoxicity. We're going to go down now to, let's see, I have antimalarials. This was just a really good little slide I found on antimalarials. I'm just going to touch on this briefly. You need to be familiar with it. Chloroquine is what you will see the most if you ever have to give it. If you travel outside of the country, plan to do any medical missions, you will hear about this. If you go and do a mission in another country, you may be administering chloroquine. There are 50 different species that can cause malaria. They're most often transferred to human beings through mosquitoes. Prophylaxis, that's preventive measures for malarial, or when you're going to go to an area that has an outbreak. If you choose to work in the health department nurses will be doing things like this, doing advising. All health departments have a section that where they give some direction management immunizations prior to traveling out of the country. Huger cities might have a specific department for that, and they might give you some chloroquinolone if you're going to an area to take prophylactically to prevent this, to take the whole time you are in that area. It's not that we see it that often, so I'm not going to go way into it. You should look over chloroquinolone chart 33.2, especially the drug lab food interaction. Interestingly, that it says that lemon juice decreases its effects. Again, you're looking at liver enzymes, blood dyscrasias, so you should be familiar, learn your RBC, red blood count, hemoglobin, hematocrit again. Because if you know something's going to affect the liver, you know something may cause blood dyscrasias, and they may cause problems with BUN creatinine. They may drop your potassium, elevate your calcium. Those are lab values you need to put to memory. There's just one on this nursing process and antimalarials. You see the little lightning thing next to nursing interventions, talking about the liver enzymes, the urine output, and if a patient drinks considerable amounts of alcohol or has liver disorder, liver enzymes require closer monitoring, and talks about the renal impairment, which I mentioned. On table 33.2, chloroquinolone and primaquine are the two to kind of be familiar with. Again, on the patient teaching, it has the little lightning bolt next to advising patients traveling, which I mentioned to you. Let's see, let's go on. And we are almost there. Anthelmintic, I always have trouble saying those. Those are worms. There's different types of worms. Tapeworm is the one that you might encounter the most. Get worms from different foods, not cooked long enough. Dirt under the nails that worm skin can be in, and you might have a child that you end up seeing that bites their fingernails, and they can get worms that way from the dirt that was under the nails. So there's different ways to get it. It doesn't mean somebody is dirty or somebody is bad if it's an undercooked meat, especially a pork or a chicken. Simple things like that can give people worms. So that is an important teaching, because anyone I have had to treat, they came in, they were terrified to say they thought they had worms. Pinworms, you check by putting a little tape on the rectum of the child, usually at night, because they withdraw with light. So you sneak in at night and put a piece of tape on the rectum, and you can find the worms. It's pretty awful, but it happens, and it's a big teaching thing that it is not due to uncleanliness. These things happen. Anyway, these medications, anthelmintics, are agents that destroy the worm. Unfortunately, the side effects are GI distress, anorexia, nausea, vomiting, sometimes diarrhea. I have heard the stomach cramping can be significant. They may have neurological problems such as dizziness, weakness, headache, and drowsiness, but the symptoms usually aren't significant because they take it from 1 to 3 days. I know when I have prescribed it, I've given on the bottom of table 33.3 parental panoate. It's Pinex, which is actually can get over the counter. It's a pregnancy category C, but it is a single dose, and that's what I've usually treated with because you're lucky to get them to take it. So 1 dose, especially in a kid, is about all you're going to get. This is just interesting information on the parasitic worm killers. I just thought you might want to read it. Where it says on the bottom, rarely fatal, but is a major cause of ill health. On the bottom, let's see here, on your nursing process, if you go to the end of it on page 458, note the little lightning bolt and explain to patient the importance of washing hands before eating and after going to the toilet and how it can be transferred within the family. So to end this, I decided to put a little funny in here. I thought this was cute. Ebola, oh yeah, malaria, well, I have cholera. What about you, Chuck? Chuck? Dang, Chuck wins. The first Deadliest Catch TV show was far less popular. I just thought that was cute. We are almost done with this unit, and this is the end of chapter 33.